Support comes from Mosby Building Arts, designing custom bathrooms that fit every personal style. More at callmosby.com.
This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha. In 2022, Samantha Slecka found herself strapped to a chair by the ankles, arms, and neck. She was in custody, held in the jail in Madison County, Illinois.
I, at one point, was able to wiggle my hand out of one of the restraints, and I was trying to cover myself up with the blanket that they threw over to you. And because I was sleeping in this chair because I was in it for so long, and they caught me and they strapped me down even tighter.
The manufacturer of the restraint chair used in the jail recommends that detainees spend no more than 2 hours and a maximum of 10 in the chair. Samantha spent nearly 3 days in one of them.
You feel helpless, because they literally strap down your wrists, they strap down your head, so you're immobile. You're at their mercy completely. They could do anything, anybody could do anything because you can't defend yourself.
Samantha is not alone in that experience. Many people have gone through what Samantha endured. An investigation by reporters with the Illinois Answers Project found that county jails in Illinois restrain people in chairs on average more than 1,000 times a year, and often, as in Samantha Slecka's case, in ways that violate jail policies. To talk about those findings, I'm joined by investigative reporters with the Illinois Answers Project, Grace Hauck and Janelle O'Dea. Grace and Janelle, thank you so much for joining us today.
Thanks so much for having us. Yeah.
So let's start with you, Grace. You've spent months looking into the use of restraint chairs in Illinois county jails, and you've actually had a chance to sit in one of these chairs. What does that feel like?
Sure. Yeah, we've been working on this project for over a year now. There are different types of chairs, but generally it's a hard-backed upright chair with armrests. It's quite hard, so imagine how that would feel on your body sitting for hours, especially if you can't really move, you can't scratch an itch, you can't shake out a Charlie horse. Mm-hmm. And you're often strapped down at the limbs, sometimes the waist, sometimes the head is restrained as well. In Samantha's case, it was largely the wrists and the ankles that were strapped down. So it's not very comfortable, and there are serious risks to your health as well as your psychological health if restrained for extended periods. And actually, since the 90s, there's been more than 50 deaths linked to the use of restraint chairs in the U.S.
Mm-hmm. Now, the latest report on Madison County, which was published on January 29th, is part of an investigative series called Strapped Down. And in the first of these stories, Grace, you wrote that these types of restraint chairs are considered torture devices by the UN, and your description of them is quite vivid. Why then is the use of these chairs so common in Illinois jails?
Sure. So under Illinois County jail standards, they're allowed to be used as a last resort in emergency situations if you're unable to subdue a detainee in any other way. So if they're a danger to themselves, others, property, or they need to be transported, those are really the narrow conditions when they're supposed to be used. And as you mentioned earlier, the manufacturer even says only 2 hours. That should be the enough time to get someone else in to do something different, to obtain medical health, to obtain input from a supervisor, to be able to change course.
And as you embarked upon this investigation, what is it that you started to learn or to realize, Grace?
Well, it really started because this one man, Vernon Brooks, a Navy veteran, came to us and said, hey, I was arrested unnecessarily and strapped down in the county jail for hours to the point where the restraints, he says, cut off his circulation and caused nerve damage. And so we really wanted to identify the scope and scale of this issue in our state for the first time. And we were struck by just how much more commonly they're used than I think most people would realize, and how long some people are restrained, particularly in certain counties like Madison County.
Mm-hmm. And there are other counties, certainly, that you looked into. What are some of the findings there?
Sure. I mean, we looked into every single county in the state, frankly, and then based on the trends that we were seeing, we would go deeper. We looked into Coles County, Illinois, where not only were staff strapping people down to chairs, but they would attach what is known as a stun cuff. Almost imagine an ankle bracelet or a shock collar for a dog, but put on a person, and people were shocked while restrained. That was quite egregious, so we looked into that. Peoria County as well. There were many people who were severely mentally ill who were being strapped down to chairs in and out for days, repeatedly, likely because of self-harm or underlying mental health issues that were not being properly addressed and treated.
Now, Janelle, I'd like to turn to you because you joined the Illinois Answers Project this summer, and you took on quite the hefty challenge of analyzing the data on this. And you ran into some challenges there. Tell us about that.
Well, I think the first thing I just want to say is that Grace built the database of restraint chair incidents and really led us to this data in Madison County that made me say, let's take a deeper look at this. Yes, I joined Illinois Answers back in the summer, my beat being Southern Illinois and the Metro East, partially because I live here in St. Louis, but also because this area just doesn't get a whole lot of investigative coverage sometimes. And so when I saw that we had this data that indicated what an expert called extreme use of the chairs at Madison County Jail, I thought that deserved a second look, and even more records were requested after that to basically dig into that and see what's going on there.
Mm-hmm. And what was the data telling you?
Basically, the main point was that Madison County has more incidents where people are restrained for 10 hours or more than any other jail in the state. And that's important because 10 hours is that top level absolute maximum that restraint chair manufacturers say the chair should be used for.
And as far as the population that is held in that jail, how does it compare with the rest of the state? I mean, is it because it's bigger that we're seeing more numbers?
Not necessarily. I would say what we found, what we were able to confirm about the population in Madison County Jail is that a lot of people there are struggling with mental illness or addiction. Often those two things can kind of commingle. Mm-hmm. And so that is often what ends up making jail staff feel like they have no other option. Like Grace said, oftentimes it's used when people threaten themselves or other people. And so when people are in the throes of a mental health episode, jail staff essentially feel like they don't have anywhere else to turn but the restraint chair at times.
Mm-hmm. With some of the numbers that you did see, what can you share with us, Janelle, that really underscores how Madison County Jail, it stands out in a very negative way from its peer jails throughout the state?
Yeah, I would say it's really just that length of time. Keeping people restrained in chair. As you said, Samantha was in it for 3 days. I talked to a gentleman who was in the chair for 14 hours, and so I would say just that length of time that people are in the chairs really shows a lack of a certain type of resources at the jail. Mm-hmm. And I spoke with the executive director of the Madison County Mental Health Board, and she basically said it. She said, if we had more money, we would be providing more to the jail, more help to the jail.
And was there data that you were not able to get your hands on? What answers are you still seeking?
So I think the main thing that we kind of hit a dead end at the end was in the jail policy, there are required checks, right, for mental health, for medical as well, health, to take people's pulse, their heart rate, make sure that they're not, circulation is not being cut off. We tried to request records to see if those checks were being done, and we were told that they couldn't give us those records for detainee privacy reasons. We were given a call log one time for one of Samantha's restraint episodes, but we weren't able to determine from that call log who was called and if the nurse that was called on that call log was called for Samantha. Mm-hmm. So we kind of hit some dead ends with that, and we wish we could have confirmed if these checks were done or not.
And what I will add to that, too, is in Sleka's case, her restraint episode started on a Monday, restrained for about 36 hours, released briefly, restrained for another 12 hours. It wasn't until that Thursday that jail staff indicated any sort of visit with a crisis worker or an intervention staff. That's something that, according to county policy, best practices should have happened much sooner. And Sleka also identifies that as one of the concerns she had. She asked, why did no one come help me? Why did no one come see me sooner?
We're talking with the two reporters from Illinois Answers who are behind a new investigation that's looking into the use of restraint chairs in the jail in Madison County. And these two reporters are Grace Hauck and Janelle O'Dea. Now, Grace and Janelle, one of the subjects your reporting gets into involves the company that makes these restraint chairs. They're used in Madison County and other Illinois jails, and the company is called Safety Restraint Chair Incorporated. Its website includes a couple of instructional videos for strapping someone down.
The patient that you see will most likely be resisting what you're trying to do with them or to them as you go through this restraining process. And so the real process will be much more physically demanding than what you're going to see on this video.
Now, what stood out to me about this video after reading your investigation is that it shows people like jail staff how to use the chair, so how to operate it, so to speak, but not how it should be used. And the term patient being used there also is very interesting. Grace, why is there a disconnect between the manufacturer and these jails?
I think that's a question that jails and jail staff need to answer. I think something that we've identified is a lack of oversight and accountability. And often some sheriffs and jail administrators said, hey, we actually didn't know about some of these instructions and some of these requirements. We didn't know there were supposed to be medical and mental health checks until you came and asked us. In fact, of the 5,500 known incidents over the 5 years, only half were ever actually reported up to the State Oversight Board or the State Oversight Unit here in Illinois. That also just shows that at large scale, there's a lack of any sort of inquiry or transparency about what's happening. And when jails do use chairs in this way, they're often never asked about it or held accountable until now.
So this, I guess the defense that they didn't know, I mean, is there more that this company could be doing when it comes to how their customers use their products? You know, for instance, could the chair itself be made safer? Is that a reasonable expectation?
I don't think the answer lies with making changes to the chair or a different model of the chair. I think the best solution here is the one that obviates the need for any chair in the first place. How can you get people the help and the resources they need without responding with a blunt instrument as kind of this gut reaction to kind of quiet a nuisance or basically just get rid of an issue that's happening? Why not actually provide the resources that people need and have a culture change in facilities to ask, hey, why are we actually using these and what could we be doing instead?
Janelle, getting the data about how often these restraint chairs were used and how long people were kept in them, what kind of work did that actually entail?
Yeah, so again, Grace actually did most of that work, all of that work before I arrived. And what it entailed was her requesting thousands of pages of records from county jails individually and also from the state, and then building that into a database and comparing those records, to see, as she mentioned, about half of the incidents statewide that were not reported. And so that's how she figured that out, was by requesting records from the jails, from the state, and then comparing the two. And all of that work took her about 9 months. That was before I even arrived. And then they had done the statewide look. They had looked at a couple of specific jails by the time I arrived, and I zeroed in on Madison, like I said, because of the extreme lengths that we saw. So it took, and then, when we were reporting on the Madison County story, we got even more reports and records. So just thousands of pages of government documents that we went through, and hours we spent going through them and making sure they said what we thought they said.
And why do you think that is something that people should understand?
I just think that we are in a place right now where obviously trust is low with the media, with press in general. And so I like to be transparent about how we do our work and what we do to get you to get to this investigation, to publish this investigation, so that people know that we are working hard to get records, to verify information, and that they can trust what we are putting out there.
Mm-hmm. Grace, what is it that we know about other states' use of restraint chairs?
Yeah, I have not seen an investigation or any sort of report put out that is able to quantify how often restraint chairs are used and how long they're used for in other states. But there are states that are far better with transparency on this issue. For example, in Pennsylvania, the Department of Corrections collects data from their jails and makes that available online. So anyone in the state could go and say, hey, how often is my jail using restraint chairs? And compare to what other jails are doing in the area. Mm-hmm. There are a number of states that have tried to intervene on this issue, like Florida and Utah. I believe their prison systems have stopped using restraint chairs in their facilities, but the jails still do. Some have more restrictions. For example, the state of California in their state code say at the 8-hour mark, if someone's still in a chair, they need to be taken to a hospital because you cannot restrain them for longer than that period. Mm-hmm. And so it kind of depends on, what agency you're talking about, what level change is happening, but we are seeing some incremental changes in different parts of the country.
Mm-hmm. And I understand that there is work underway to look into jails in Missouri. Is that right?
Yes, there's actually an investigation happening led by KMBC looking at both Kansas and Missouri. They've put out a couple stories so far, really using our approach to gathering this data as a roadmap to say, hey, can we get these county policies from jails in Kansas and Missouri? Can we get the incident reports? I know they're facing much more pushback than we have faced in Illinois, just because we have slightly different laws regarding the public records access. But that investigation is happening as we speak.
Mm-hmm. Grace, what are some of the official responses you've had to these findings?
It varies. So some state lawmakers here in Illinois have called for reform or a subject matter hearing or changes to state-level guidelines and expectations around the use of these devices. Others have said, hey, we need to stop using these altogether. At the county level, there's some small reforms happening. For example, in Madison, they're going to try and video every use of the chair now. They have been doing more de-escalation training. In Coles County, they've stopped using those stun cuffs that I was mentioning. In Peoria, the mayor released a statement when we put out that story. And so there's a growing level of awareness. And now many of the jails that actually were not reporting these incidents up to the state unit, those jails are all reporting now. And so hopefully that in the future will at least give the state and give us a sense at scale of how this is continuing to play out.
Mm-hmm. And in our last minute here, we've talked about the investigative part. So simply put, what does your work point to regarding solutions, Janelle?
I would say, like Grace said earlier, that there just needs to be, it's tale as old as time, really. The needs the resources do not match the needs, right? Like we do not have enough mental health resources or enough addiction services for folks that are in the criminal justice system. And so just if state legislators, lawmakers can think about carving out some more money for that, so finding some way to provide some more support, I think that is one step in the right direction toward not using these chairs anymore and giving people, like Grace said, the services they really need to make a recovery.
And Grace, quickly, your thoughts?
I would just add transparency, oversight, and accountability. A lot of change is happening simply because we asked, simply because we counted, and we're able to show at scale how often this is happening and why. And that's something that should have already been happening. Mm-hmm. There should already be oversight, and whether that's the Department of Corrections or a separate body, that needs to be happening daily.
You can read Janelle and Grace's work at illinoisanswers.org. Thank you both for joining us today.
Thank you so much for having us.
Thank you.
This episode was produced by Danny Wissentowski.
Audio engineering and podcast design by Aaron Dorr.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations, and leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thank you.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
The Gateway brings you the day's news each weekday from around the St. Louis region and the state capitals in Jefferson City.
Our schools are accredited. We don't need this bill.
And Springfield.
How many more years must pass before lawmakers see time is of the essence?
I'm Abby Larico. Join me each weekday for The Gateway on the STLPR app or wherever you get podcasts.